Hello friends, today our topic is hypertension. Let's see. In the introduction of hypertension, we will discuss about the definition of hypertension. An abnormal high blood pressure is called as hypertension. The systolic blood pressure will be more than or equal of 140 mmHg and diastolic blood pressure will be more than or equal of 90 mmHg. Hypertension is also known as a blood pressure. It is a long-term medical condition in which the blood pressure is in the arteries is persistently elevated. Now, the types of hypertensions are normal, pre-hypertension, hypertension stage 1, hypertension stage 2, and high blood pressure over age 60. At first, in normal hypertension, the systolic blood pressure will be less than 120 mmHg, while the diastolic blood pressure will be more than 80 mmHg. In prehypertension, the systolic blood pressure will be in the range of 120 to 139 mmHg, while the diastolic blood pressure will be in the range of 80 to 89 mmHg. In hypertension stage 1, the systolic blood pressure will be in the range of 140 to 159 mmHg, while the diastolic blood pressure will be in the range of 90 to 99 mmHg. In hypertension stage 2, the systolic blood pressure will be more than or equal to 160 mmHg and diastolic blood pressure will be more than or equal to 100 mmHg. At last, the high blood pressure over age 60, it commonly occurs in the people whose age is more than 60 years, in which the systolic blood pressure will be more than or equal to 150 mmHg and diastolic blood pressure will be 90 and above. Now we will discuss the etiology of hypertension. Etiology means causes. The causes of hypertension generally includes smoking, salt consumption, age and sex, sleep apnea, overweight, alcohol consumption, genetic, stress and cirrhosis of liver. Uh, Smoking is the most common cause of hypertension. The hypertension varies according to age and sex. Now we will discuss the risk factors of hypertension, in which the age is most common risk factor for hypertension. The chances of hypertension is more in the people whose age is more than 50 years. Alcohol and smoking is also the most common causes of hypertension. The excessive dietary intake of sodium, family history, obesity and gender also affects on the hypertension. Sedentary lifestyle and stress, they leads to hypertension. That's why we should exercise daily to avoid the risk of hypertension. Now the signs and symptoms of hypertension, that includes severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, confusion, epistaxis, chest pain, shortness of breath, irregular heartbeat. Now, the pathogenesis of hypertension. This chart is quite blurred. Mm. Now we will discuss the pathogenesis of hypertension. Sodium is essential for body when excess sodium intake. Due to this, our body mechanism get disturbed, and to maintain the isoosmotic pressure, water absorption get increase in the body. As the water increases, the sodium gets diluted. The tension develops due to the increase in blood volume. Renin-angiotensin mechanism, we know kidney secretes angiotensin, when there is a less concentration of sodium, the juxtaglomerular cell gets activated in kidney, thus secretes renin. This is a angiotensin converting enzyme in lungs. Then it gets converted into angiotensin 2. But here is a condition of hypertension. So instead of releasing the sodium, more amount of sodium is absorbed in kidney. In kidney, aldosterone secretion also increases. Due to the vasoconstriction sodium in blood, it is not released. Nor epinephrine also responsible for vasoconstriction. That is also increases the pressure. This is the pathogenesis of hypertension. Now we will discuss the treatment or the management of hypertension. The management of hypertension includes the non-therapeutic and therapeutic treatment. Non-therapeutic treatment includes the reduction of salt intake, reduction of sugar intake in our diet, eating at least 5% of food and vegetable per day. Calcium, magnesium and potassium supplements are most recommended in our diet. Weight reduction, keeping alcohol within the current national recommended level. Also the low dietary salt and regular controlled exercise helps us to overcome the hypertension. Now in the therapeutic treatment, it includes diuretics. These are the drugs included the production and secretion of urine and reduce the blood volume. Also diuretics includes the angiotensin blockers. Then beta adrenergic blockers. These drugs, by blocking the effect of the hormone adrenaline, they cause your heart to beat slower and less force. Now calcium channel blockers. We know that the calcium is the key ion for muscle contraction, and we also know that the blood vessel made up of small muscles. Also alpha blockers. The alpha blockers block alpha receptor mediated vasoconstriction. They work by keeping hormone noradrenaline from tightening the muscles in the walls of smaller arteries and veins, which causes the vessels to remain open and relaxed. ACE inhibitor. The full form of ACE is angiotensin converting enzyme. These drugs block the conversion of angiotensin 1 to angiotensin 2 as the vasoconstrictive action. Now the last, angiotensin 2 receptor blocking. This helps to relax the blood vessels by blocking the action of a chemical that narrows blood vessels. These all are the treatments or the management of hypertension. Thank you for watching.